Sarcoma, an overview. Sarcoma is a rare and diverse group of cancers that arise from connective tissues, such as bone, cartilage, fat, muscle, and blood vessels. It accounts for about 1% of all adult cancers and approximately 15% of pediatric cancers. Sarcomas can develop anywhere in the body, but they are most commonly found in the arms, legs, abdomen, and chest. Types of sarcoma. Sarcomas are broadly divided into two main categories based on the type of tissue they originate from. 1. Soft tissue sarcomas. Liposarcoma develops in fat cells. Leiomyosarcoma arises in smooth muscle tissues. Rhabdomyosarcoma originates from skeletal muscle, more common in children. Angiosarcoma forms in the lining of blood or lymph vessels. Synovial sarcoma typically occurs near joints in arms or legs. Malignant peripheral nerve sheath tumors develop in the protective lining of nerves. 2. Bone sarcomas. Osteosarcoma, the most common bone cancer, usually affects teenagers. Ewing sarcoma affects bones or the soft tissue surrounding bones, common in children and young adults. Chondrosarcoma develops in cartilage, more common in adults. Causes and risk factors. The exact causes of sarcoma are not always clear, but some factors can increase the risk. Genetic mutations. Alterations in DNA can lead to uncontrolled cell growth. Inherited syndromes. Conditions like Li-Fraumeni syndrome, neurofibromatosis, and retinoblastoma increase susceptibility. Radiation exposure. Prior radiation therapy can increase the risk of developing sarcoma. Chemical exposure. Certain chemicals, such as herbicides and industrial toxins, may raise the risk. Chronic lymphedema. Persistent swelling caused by lymphatic fluid buildup can lead to angiosarcoma. Symptoms. Symptoms depend on the type, size, and location of the tumor. Soft tissue sarcomas. A painless lump or swelling, which may later cause pain or restrict movement as it grows. Bone sarcomas. Bone pain, swelling, or fractures without significant trauma. Diagnosis. Diagnosis often involves a combination of 1. Imaging tests, X-rays, CT scans, MRI, and PET scans to locate and assess the tumor. 2. Biopsy. A sample of the tumor is taken to determine if it is cancerous and to identify the type of sarcoma. 3. Histopathology. Microscopic examination of tissue to confirm the diagnosis. Staging. Sarcomas are staged based on their size, location, spread to nearby lymph nodes or other organs, and histological grade. Stage 1, low-grade, localized tumors. Stage 2 and 3, higher-grade tumors, with or without local spread. Stage 4, metastatic sarcoma. Treatment. Treatment depends on the type, size, location, and stage of the sarcoma. 1. Surgery. The primary treatment for most sarcomas aims to remove the tumor with a margin of healthy tissue. 2. Radiation therapy, often used before or after surgery to reduce tumor size or eliminate residual cancer cells. 3. Chemotherapy, effective for certain types like Ewing sarcoma and rhabdomyosarcoma. 4. Targeted therapy, focuses on specific genetic changes in cancer cells. 5. Immunotherapy, uses the immune system to fight cancer, though its role in sarcoma treatment is still being explored. Prognosis. Prognosis depends on various factors: type and grade of sarcoma, size and location of the tumor, whether the cancer has spread, metastasized, patient's overall health. For localized sarcomas, the 5-year survival rate can range from 50% to 80%. For metastatic sarcomas, survival rates drop significantly. Research and advances. Ongoing research aims to improve sarcoma outcomes, development of advanced imaging techniques for better diagnosis, identification of genetic and molecular markers for targeted therapies, clinical trials exploring novel drugs and treatment combinations. Living with sarcoma. Patients with sarcoma often require multidisciplinary care, including regular follow-up to monitor for recurrence or metastasis, physical therapy for rehabilitation after surgery or treatment, psychological support to cope with the challenges of a cancer diagnosis. Sarcoma is a complex cancer that requires personalized treatment plans and a team-based approach for optimal care. Early diagnosis and advances in therapy continue to improve outcomes for those affected,